possible acquired pneumonia. So that's going to happen with anyone after they've been admitted more than 48 hours and they're not on a vent. So a lot of times we talk about ventilator associated. This is non-vent. It's kind of under-recognized. I think I was reading, it's not one of those like mandated or like a surveillance infection yet. I think it's going to probably come because it's happening more and more. It affects up to like every 1 in 100 patients. And it just has really poor patient outcomes. Like they might end up staying longer, they're on more antibiotics than they really, there's increased antibiotic use, higher readmission rates, and then just increased costs. It can cost up to like $20,000 just for this infection. So basically, our body, we all have germs, pathogens, but our mouth has a lot, and then people are maybe like aspirating, and they might be silently aspirating, so just little micro aspirations throughout the day, and then otherwise, sometimes after someone eats and then they aspirate their coffee, it's like more obvious, but so that's one of the leading causes is just these little micro aspirations, and so the germs are just then going into their lungs. So compared to vent associated, it's 65% of infections are non-vent related, 35 are vent related. So they can be on oxygen, it's just no ventilator. So something the PCAs can do to help is oral care. And then other things we can do is just making sure like we're doing aspiration risks. So like maybe they're sitting up nice in bed and they're, maybe there's someone that, if we're worried, maybe we're supervising them with eating, or maybe they're working with like speech or OT, but education, aspiration risk management, and then lots of oral care. So, and then make sure you chart, give credit for the work that you did. Because I know they do some audits sometimes on oral care. I don't know if MedSurg does, but McHugh has done that before. We'll go in random charts and just see is oral care getting documented. So just take credit for that, and maybe offer it multiple times in your shift, like someone's NPO. Maybe instead of just swabs, maybe hand them the toothbrush a couple times, and that might help make them feel a little better too. But and maybe you have someone with dementia or someone's just not feeling well and they're like, no, I'll do it later. But maybe think of other ways to reapproach instead of like, do you want to brush your teeth? Maybe just hand them and say like, you should just brush your teeth while I'm in here, I'll help you. Or you can do like a hand over hand thing and get them going, and then maybe they're like, oh, someone with dementia might, that task is recall where they can just start, but maybe getting started is tricky for them. So oral care is a huge thing, and then the other thing we're talking about is Heroes for Zeros. You guys know what that is? It's kind of a newer thing, so you can add it. The charge nurses are supposed to be adding it to their system list, or like their favorite, and then it'll show, it's kind of small, but it'll show the patients, and then things like aggression flags or MyTap scores or like Foley care done for the shift. It'll be highlighted. It'll say like do or it's done. It'll say yes. Central line, the CHGs if it's like something that's due. So it's kind of a nice way to organize your unit list, or it organizes it for you, but it's a nice like quick look. But we'll start with the Cauti. So for PCAs, we're going to try and prevent Cauti, so urinary tract infections acquired in the hospital with use of catheters. We're going to use those Foley wipes. Do you know how often you're doing those?
8 hours.
Yes, and then with any bowel movement. So once a shift and PRN, and then make sure again you're charting that. So, and I think that's helpful for people that maybe have that split shift of like you do 12 and then someone else is there. So like if you did it 3 to 7, then they don't necessarily have to do it, but I think it's kind of, I think people are in the habit of doing it with like bedtime cares, but so yeah, making sure that we're doing those Foley cares, and then we are using the whole pack. Don't leave a partial just sitting there. We should be using the whole pack. And then other things that we can do with the catheters, make sure there's no like loops in the tube, the tubing, and then I was saying earlier, like our beds, like the little hook where we can leave them, it's often the bag is like sitting on the floor, and it drives me crazy because there's no other good spot sometimes. But if you can find a way to keep it going, like the flow straight and not like uphill, and then somewhere to hang it so it's not touching the floor. And then again, like if you don't need to be emptying it multiple times, like less is better for opening that closed system out, and then like wiping that off, alcohol wipe before you do, and then again just charting that you did those cares. And then the other hospital-acquired infection that's part of Heroes for Zeros is the Clabsi. So anyone with a central line, whether they came in with like a port, or maybe they got a PICC line put in, or a central venous catheter, like you'll see in the IC, a lot of times they'll have like the IJ out the neck. Someone could have a femoral line, but those are that's the worst site for high risk of infection. But any sort of central line, port, PICC, we need to be doing daily CHG wipes. And so you're gonna skip the face, but you're gonna use the whole pack. There's 6 wipes, and you're gonna do like torso, one for the arm, kind of like groin area, down the legs, and then the back side is one. You can do 1 wipe down with that. So that final wipe is there. The skin's gonna feel sticky, but don't wipe it off. It'll dry. But that is going to help prevent like a central line infection. Those are not good. People can get really sick from those.
Another thing too, Bonnie, I forgot to add earlier, that if they can do them themselves, besides their back, have them do them themselves. Just say, hey,
yeah,
you want to just wipe yourself off with the wipes and let them know what it's for? They can do it all. You might have to do their back, but they can do it all themselves. That's what I usually do. If they can.
We try and do them on night shift, but if it gets missed, or maybe they renew, admitted overnight and they need one done, but yeah, that should be done daily. So it helps reduce the amount of germs on the skin that could get into that like insertion site or into the central line. And things you might see with either of these infections is they're developing a fever, so any over 100.4. They're maybe more fatigued, maybe they're going into a more rapid like tachycardia or like AFib RDR. So you'll see like changes, signs of infections. And then again, just take credit for your work, just make sure you're charting it, because it's definitely something that gets like audited, and we just want to make sure it's getting done because it can reduce all of these infections.